We absolutely have a drug crisis in central West Virginia, in all of West Virginia, in all of the country. Substance use disorder or addiction does not discriminate. It is a young person's disorder, an old person's disorder, and everything in between that. I mean, we are all one car wreck or some tragic event away from being addicted to pain medication, and from that move into street drugs. And we've seen that. We hear those stories.
I worked in the steel fabrication field and building mining equipment and whatnot, and I've injured myself quite a few times and become addicted to opioids. You know, I can't blame the doctor for everything, but he started me out on hydrocodone, 10 milligrams, 4 a day. I did that for like 6 years. He got in trouble and lost his license. I went to him one day and he said, I can't write you any more pain medicine. It's like having your hand in a vice, nothing's gonna help. And I had to go back to the drug, buy it on the street. And
there wasn't much to do where I grew up, and I was running with people that were older than me, so it was kind of inevitable. But I started real young, I dropped out of high school. By the time I was, 17, I was shooting up. I just couldn't do it anymore. I was just, I didn't want to be that mom. I wanted to give my daughter a life, and I just screwed up. After she was born, I couldn't, I did the best that I could do, and it wasn't good enough. And I went to jail when she was little, and I'll never forget how devastated I was. But that was when I found my way here.
My freshman year of college, I just started dabbling with just small pain pills like Loratabs and stuff like that. And then the Oxycontins came into my life and pretty much destroyed my life. It all went downhill from there. I knew I needed help, and just quitting for me wasn't an option. I needed some other course of action.
The sadness and stuff led me to start doing things like, drinking when I was 14 years old. So it just snowballed from there into college, just every night, just drinking and doing, every night, whatever, anything to make me numb, to not feel sad and empty. And you become just the most horrible version of yourself, like things that you think would never do that. Oh yeah, you'll do it.
Every day I was looking at the shotgun. I wanted to kill myself, and I was getting absolutely afraid of myself. I done got tired of being sick, tired of going through the lifestyle of depriving my family. I've lost everything. I never was a criminal, go out here and rob people, but I robbed my family. I deprived myself. I used to have a gun collection, probably fill this room we're sitting in, and I'm down to one shotgun, and I was going to use that shotgun on myself, If I wouldn't have got the answer on the other side of the phone, I wouldn't be sitting here today.
I have a particular lady's phone number here. I could call her at 3 o'clock in the morning, and she would answer the phone and drive to wherever I was at if I needed her and help me. If it wasn't for her support, I wouldn't be here. Because, there's been plenty of times I just wanted to give up, and she kept pushing me and pushing me and pushing me, and thank God for that.
What we need to do is address it kind of like a knot and come at it from multiple angles. So instead of you pull a knot from one end, it's just gonna make it tighter. If you come at it from the mental health side, the physical health side, and the addiction side, and try to pull this apart to get that person out of basically all of the issues that have built up over time.
Medication-assisted treatment at Cabin Creek is really primarily a Suboxone-based treatment program for people suffering with opioid addiction. A very protocol-driven, systematic approach that we apply using group therapy and individualized therapy to give people as many possible tools as we can, besides just the medication, to help them to stay sober.
The people in the program are really supportive. They actually care, and you can feel that.
I fully believe that everybody given the right opportunity can recover or be in recovery from this disorder. I've seen people come in here that I don't know how they got here. They were in that bad a shape, or that they were going to die before we could get them in here. And within a month, You see these people walking taller and feeling better.
If you'd seen me like when I first started, like the day I walked in to Cabin Creek to right now, it looked like two completely different girls. My first appointment here, it was, I just knew, it's like, this is it. These are the people that are gonna help me. This is the place. I knew.
When I called and talked to this lady that works here, her name's Lois, just the conversation over the phone when I first talked to her, she was saying things to me about this program, about the help here, and the respect I was getting. I just give up hope, man. In this program, like I said, I've been in other programs, but none like this program that actually really wants to help you. And it's given me hope to be the person I would like to be instead of the person I have been through my addiction.
What we do is try to basically individualize that treatment at that point. So, okay, yes, you're going through recovery, you've got sobriety, but what do you want life to look like from here? What do you want to succeed with? What do you want to get back? Do you want to get more education, get a better job, get your kids back, repair your relationships, get your license back? And so we try to address, all of those aspects, education, mental health, physical health.
I came in with the purpose to get my kid back with me, and I hit the ground running. Started the program, started doing 4 meetings a week, 4 NA or AA meetings a week. The therapy here, the one-on-one sessions, everything. Like, I started learning so much.
The medicine's really just kind of like a tool that keeps me like normal. And then it gives me the opportunity to be able to learn how to be a person. It lets you think clearly. It lets you be able to learn. It opens you up to like growth.
The medication helps them with their cravings, and it also helps them not relapse because the medication contains naloxone, which is Narcan. So it helps them not relapse.
Suboxone is an opioid partial agonist, which is medical lingo for it basically doesn't get you very high, but it is affecting the opioid receptor, which heroin does affect as well, but it's not going to stimulate it to the degree that's going to be necessary to get a so-called high. And in fact, there's extensive data now that a person, even on very high doses of Suboxone, is not impaired whatsoever. They can operate heavy machinery, perform employment without any difficulty.
It allows you to be able to function and not go through the withdrawal symptoms.
A lot of people think that Suboxone programs are bad. They think you are trading one drug for another. I can speak on that because I've done that my whole life. One to another to another. Alcohol to cocaine and marijuana and all that stuff, to pills to heroin, name it. I have a 20-year track record here with drugs. I did not trade one drug for another though, because all those times in my life, alcohol to cocaine to pills to heroin, my life got increasingly worse. In the hospital with endocarditis and your son being taken away from you, that's not good. And don't forget homeless, jobless, that's my life got terrible, worse every time. I start a medication-assisted treatment program and my life got, better.
We view this as a medication to help this person get in and stay in recovery. It would be much like putting someone on insulin for diabetes and then saying, we're only giving you insulin because your diet's improper. And then expecting them to repair their diet and then take their insulin away.
When I started MAT, it was very difficult for them to talk me into doing it. I didn't want to do it. I thought that I wasn't going to be helping anyone. Medication-assisted therapy with Suboxone is considered the standard of care for helping people with addiction, but I didn't know that as an internist, as a fully trained physician, and I didn't even believe it once I was even doing it for a long time. It actually only happens if you get to see people changing their lives that you start to see it differently.
You change your whole life when you do things the right way. The medicine just lets you think right, and then you make the life changes that are necessary. Those life changes come after you become normal.
Kind of the way I was raised is addiction was a moral issue, and it was all based on your values. You choose to do this. You choose to basically to mess your life up. And actually getting to interact with the patients and getting to know them, you start to realize that part of that choice is removed, that they learn that this is a way to cope, and based on the cravings, the compulsions to use, is the choice is basically taken out of their hands. And you kind of have to ask yourself, who of us when we were growing up said, I want to grow up and be addicted? Like, nobody said that. And so why would these people be any different?
This is actually about recovery. This is not just a come get your medicine, get your papers signed, return your papers, and go home. They care about you. They want you to do good. Your success means something to them. Like, they genuinely care about you.
We have dedicated staff. With dedicated employees who are willing and able and want to see these folks get better. And we believe if we treat people better, they get better.
It's rigorous and it's intense, and it's for good reason, because in the beginning, we have to be held accountable for our actions, because we have to relearn everything. We have to relearn not to lie and be deceitful and be honest and upfront and transparent, and learn how to be responsible and trustworthy and then productive and dependable. Most people take it for granted, I would assume, that those traits, but we have to relearn all those things.
We've heard several times that this medicine is nearly a miracle drug for these folks. It helps them feel normal, be normal, act normal, and progress normal.
When I could be a husband, a dad, a provider, a grandpa, which I have a great family before, and I couldn't do none of that stuff. I couldn't be a dad, I couldn't be a husband, couldn't be a grandpa, couldn't put food on the table, pay my bills, just live, man. It's a whole life change, man. Everything's better. I never have ever had sobriety like that in my life.
It has changed my life, and I am so eternally grateful for it. I have my kid back. I got custody of him back completely. He is 100% mine and nobody else's. And that's awesome. That was my goal, and I crushed it. I have a job. I'm employed. I work a night shift every night, overtime, all the time. I volunteer for it. I take that. I'm gonna need that. Single mom.
The biggest thing that I've learned in my recovery is that everything I've done, the good, the bad, the ugly, and the in-between, has got me where I'm at right now. I'm a mom. I'm a general manager for a restaurant. I work 60 hours a week.
I'm currently a barber. To change someone's appearance in a small way and just make them feel better about themselves is really the main thing that I like about being a barber. I guess it just goes back to the whole being of service, just getting out of myself, just putting someone else in front of me for once.
Faith has a lot to do with my recovery. It has a lot to do with it because it's helped me in every aspect. I thank God that I do have a relationship with Jesus, and that's a big thing a lot of people don't have.
That's been the best choice that I've made in my life. It's actually got me stable. I'm able to just live life, really. Able to work, able to spend quality time with my son and my family, and just actually be present in life, which I wasn't able to do before that.
Having my son back in my custody is absolutely the greatest feeling in the world. I was on cloud 9 forever. It made me very, very, very happy to have him back. And he is so happy to be back. He's like, I don't ever have to go away. Nope. And I'm all yours. You're all mine, buddy. And he just loves it. And I love it. And Very, very happy. He's a true mama's boy. I'm very lucky.
Everyone can see the steps that I've made, the way that my life has become better, and I've just become a better person. It lets me be able to actually live life and be happy again. You don't feel like you're high, you just don't feel like you're sick. It's not doing anything for me but better in my life. And my past experience, if I was on a drug, it would be making my life worse instead of making it better.
It's not always going to be bad. And if you want something bad enough, then you can take it. And once you make that decision that that's what you want, you won't let anything stop you from achieving it.
I can be a dad, a husband, a grandpa. I can be alive.
Because the hardest thing that, in my mind, that somebody has to do is to reach out to a bunch of total strangers and say, I'm an addict and I need help. Because they've been discounted their entire adult life, and some of them as children, as subhuman, that they don't matter. They're an addict. They caused this disorder in a lot of people's mind. I've had folks say, I used to not look at my face in the mirror when I brushed my teeth, where I'd get out of the shower and hide from myself because I couldn't stand to look at who I was. Now I'm getting my hair done or getting it shaven regularly because they are proud of themselves. And for us to witness that self-pride and that self-care that they develop here, it's incredible.
And the more you interact with patients is you start to understand that they are human, if not more human than any of us are, because they've been through the rough times and they're still trying. They still have that hope, which is a basic part of being human. They're still working towards that despite everything they've been through.
People have actually said to me, why do you do that kind of work? Why are you trying to help these folks? They're drug addicts. They're useless. They're all going to die. Why do you do that? Well, I know better. I've seen it hundreds of times. Everybody is worth saving. These are our brothers and sisters, our children, in some cases our mothers and fathers, and it's humanity. Everybody is a life worth saving.